So what I'd like to do now is show a couple of cases that are actual cases from my institution. So our first patient is a 63-year-old female. She presented for her screening mammogram with no complaints. The first mammogram I'm going to show was performed in 2017, and there was no tomosynthesis performed at the outside facility. Here are her craniocaudal projections, and you can see she's fairly dense, and her medial lateral obliques. So then she presented to our institution in 2021. And on her images, she was recalled for distortion in her left superior breast. There was no documentation on her medical record of any prior biopsies. Here was the area seen on the tomosynthesis slice. As I talked about, with tomosynthesis, we're starting to see these areas of distortion that really in 2D, we really just couldn't appreciate. So the patient was recalled. When she returned, the technologist did some spot compression views. Here's a spot compression view that was performed, and another projection where there was still some distortion seen. This is her full lateral. When she came in to show me the case, I said, "Are you sure this patient didn't have any biopsies? Can you please go back and just ask her if she had any prior biopsies?" So the technologist came back and said, "You know, she does have a scar. It's very faint, but I see it in her left breast." And I said, "Can you please go back, mark it with a scar marker, and take some additional projections to see if it actually does coincide?" So here you can see, after the technologist put the scar marker on, it does correspond to the area of distortion as seen on the spot compression view. And also on the full lateral, again, you can see the scar marker correlates to the area of distortion. So again, it's really important that as part of the protocol, the technologists are really consistently asking the patient, even if they're not maybe marking it on the the history sheet that we ask the patients when they come in, the technologist still should be reinforcing and checking that sheet to verify. The patient was, of course, very relieved that we were able to correlate and tell her it was just her surgical scar. But again, she had to take off work. She now may incur some cost and the additional radiation. These are all things that we'd like to minimize if possible. These are real life patients that, again, we want to think about their inconvenience and their anxiety. Some of these patients come in and they're very nervous, maybe because a family member had breast cancer or a friend was recently diagnosed. So anything we can do to decrease the anxiety is certainly important.